We'll call the Waushara County Board of Supervisors regular monthly meeting to order. At this time, we'll move ahead with roll call. Mr. Kirschner is excused. He's ill, and I have not heard from Ms. Wakely. So. Is that anybody there? Okay, with that, at this time, then we'll rise for a silent prayer and the pledge of allegiance.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, you all have an agenda before you this evening. Is there any additions or corrections? If not, I would look for a motion to approve that agenda. So motion by Mr. Urban. Is there a second? Second by Mr. Mosling. Any discussion? All in favor? Aye. Opposed? Okay, and that passes. You were also sent the minutes from the December 16th, 2025 regular meeting. Is there any additions or corrections to those minutes? Okay, hearing none, I would look for a motion to approve those. Motion by Mr. Peterson, second by Mr. Bossart. Any discussion? Okay, hearing none, all in favor? Aye. Opposed? Right, and that passes as well. We have one person who wishes to comment for us, and I will just read this before we start. Please keep in mind that the county board will not be able to respond to your comments or ask you any questions. Your comments are informational only. If further action is required, your comments or concerns will be directed to the appropriate department or committee for response. So with that, I will ask Ricky L. Brown Jr. to come forward and speak. You have 3 minutes.
Good evening. My name is Ricky Brown Jr. I'm from the county here. I live in Hancock. I'm here today to talk about the issue with the sheriff again, because I feel like there's not a lot of traction going on with this issue. The man is clearly guilty of violating state statute 943.20, which states a public official by virtue of their office intentionally uses, transfers, retains, or conceals money or property contrary to their authority, intending to convert it for their own use, which he in fact did. Okay. Now, by the fact that the board required him or asked him to pay it back and he's agreed to do so is an admission of guilt, honestly, in the mind of the public. And I hear from a lot of people out about that seen me last time I was here, or heard from you being here last time. They don't appreciate the fact that it seems like the board or the county in general is just okay with the man stealing at a felony level, and they're just going to let him walk away with it. Now, I was just reading more information in there, and it doesn't seem that that's the case. It seems the board was pretty unanimous on the third-party investigation, which is great. I appreciate that. But I would like to see more done, and a lot of people I know I've spoken to about this issue would like to see a lot more done. If any one of you board members were to do that, you'd be in prison. If I were to do it, I'd go to prison for a very, very long time. I just feel it's kind of slap in the face to the public for this to happen and for the man not to have been arrested already. He's supposed to protect us. This guy, the kids look up to this guy, and they see that he can get away with doing whatever because he wears a badge. That's not okay with me. And I'm not against all police. I don't want to speak for the man, but there's an officer here who I would probably say I'm a pretty reasonable guy. I can talk to him. I have no problem with him. I respect him. I feel like he respects me. It's not a matter of me versus the police. It's about what's right. And if somebody's trusted with looking out for the best interest of the public, and they abuse that trust and they take it upon themselves to take from us when we could use that. They need to be punished for it. Additional issue I have real briefly is the library in Granite is having a funding issue. I don't know what you guys or how you guys are tied in with that, but I went and spoke to the board meeting over there. And it seems like they're really short on funds and they could really use it. I don't want to see the village of Granite lose their library. It's one of the only resources we have for children, and it's one of the only things in town we have that's not the internet, which is polluting children's minds. So if there's something we can maybe do about that or even discuss it, we can try to figure that out. That would be great. Aside from that, I have nothing. Thank you.
Okay, we'll move then into unfinished business. We have one discussion possible action item. The broadcasting all board and committee meetings live. Speak to that.
Yep, so obviously we had the discussion on this last month. IT Director West, Clerk Acantilato, and myself were able to get together just to figure out some of the logistics on how this would work. We had talked last month about capturing the main core standing committees. So I provided a list, and there's a couple more up here as well. I think she's got it up on there. So we went through our committees just to make sure we were capturing all of the boards that individual departments reported to. So we have a list here of the suggested ones that we would recommend that we move forward with. Broadcasting, what that would look like would be a WebEx link on the agendas so that people could attend them virtually. That would then be recorded and later on posted to YouTube. So different from the county board meetings, which are currently live streamed on YouTube. Right now, people at this moment could be on YouTube watching this video live. That would not be the case with the committee meetings because there's a lot more technology and steps involved in getting that happening simultaneously, but it would still give members of the public the ability to attend virtually with that link that's on the agenda. And by recording it and posting it on YouTube, it could be viewed at a later date. We did talk about this with our department heads at our meeting today. Some concerns that have been brought up, obviously staffing wise, I've talked with Barry, between Barry and Ashton in IT. They feel they'll be able to participate in all of these meetings so that they can get the virtual piece of it going. A lot of their work they are able to do remotely, so they can continue to work in meetings if necessary, or at least get the meetings up and running and recording if they need to step out to help with other technology needs within the building or within the county. Other concerns that have been brought up are something to be mindful about, concerns with citizen participation on the committees. So we have several of the committees that we have listed here do have citizen member representation on them. Sometimes we struggle to get volunteers and to get citizen members appointed or willing to participate outside of the board members here. And so there is some concern that by broadcasting video and audio recording of the meetings, that it might make it even harder for some citizen members to step up and volunteer. So that's just food for thought to consider as we move forward with it. Oh, I have one other note, so sorry. The other note that we wanted to bring up was the participation of public comment being virtual. We do need to talk about what we would be able to do, but we would like to see a recommendation in the bylaws that public comment would be done in person instead of virtually. The reason being is IT would like to have some parameters and some safety protocols in place on these links so that it is not open to anybody to be viewing or have audio sound coming through on those links without advance notice. So we'd like to limit public comment if possible. We've got to look into that a little bit, but limiting the public comment to being in person.
Okay, with that then, would anyone like to make a motion that we broadcast all board and committee meetings live with the potential of the public comment being done in person only, not virtually?
I would make that motion.
Okay, motion by Mr. Bossert, is there a second? Second by Mr. Johnson. Is there any discussion?
You mentioned at a later date, this would be posted. We have an idea what that later date is.
So IT is going to be in charge of posting them later. I believe that the WebEx links, Barry, please correct me if I'm wrong, I believe that they are ready as soon as the meeting is done, or is there a lag in getting those?
Just a little bit of a lag, but it's very minimal. We were discussing within 24 hours, it's 24, 48 hours.
I didn't want something to drag on for a month or two.
Right.
That-
Yeah, I think 24, 48 hours is reasonable.
And will you be putting some kind of a policy in place for this on how to? It all,
The internal policy and procedure we've worked out with staff, and we will touch base with the staff that takes care of creating the meetings and meeting agendas. So that they know the procedure for getting the link. IT would take care of the technology piece of it as far as starting the WebEx and recording the meeting and getting that taken care of afterwards. I would suggest that we add this into the bylaws if this is a change that we're making, that all committee or this list of committee meetings would be available virtually and recorded. And then also that change to require the in-person public comment. We will likely be looking at county board bylaws in April, as we do every time when there is a new board after an election. So it would be added into the bylaws at that point.
Good. Yes, Ben.
I'm sorry.
Go ahead.
I just wondering if we could just have like some kind of a timeline in the policy by it gets posted by X amount of days later.
So what is your preference on that?
It doesn't matter to me. I just want to make sure that we've got it ready, so it's a part of the policy.
So like a week or something.
It doesn't matter. It's just whatever's feasible, whatever makes sense.
Within 5 business days? Within 40 hours?
That's feasible for Barry, absolutely. I don't want to tie his hands or anything either, right?
Okay.
I think that's reasonable.
I just want to remind everybody, and you did it, Bart, but speak directly into your mic if you can, so everybody can hear. So go ahead, Tad.
So I thought the motion was made to broadcast live. That's not technically true. Correct? It's gonna be recorded.
It is also available by accessing the link. So there will be a link on the agenda. Any individual could click on that link and join the WebEx meeting live.
Okay.
This is just more broad-based, it's broadcasting it both in recording and live, so. Yeah. Is there any other questions? Yes.
Barry, so the live link for WebEx that's, currently at the top of the PDF file, is that what's clickable, or when you put a button where the agenda button is, where you open the PDF, could there be a second button that says watch live or attend live?
Yeah, so I'm gonna work with the website vendor to get an extra button add the agenda item. So on the website, if you go to the agenda, there'll be an option to click on that link to take you to the WebEx, and you don't have to type it all in from the agenda. The agendas are usually scanned in, so they're not clickable links. So we're gonna try to make it so it's a clickable link on the website, yes.
Okay, so we make this motion and say it's approved, how long would it take to get that link up there?
I think the goal was to have it going for next month's meetings.
Next month's meetings?
Yeah.
Okay.
Okay. Is there any other comments, questions? Okay, seeing none, then we'll go ahead and vote on that.
Supervisor.
folded, that's it.
Okay, so the motion passes. Very good. Then we'll move into new business, reports and presentations. First is our county administrator's monthly report with our administrator, Megan Kapp.
So I've continued some discussions with Green Lake County about their medical examiner and potentially pursuing a partnership with them. So we will continue those conversations and bring any recommendations forward initially to public safety and then the county board if that is going to pan out with a partnership there. Personnel wise, we had our annual all staff safety training held yesterday. We had very good turnout for 2 sessions there. That was coordinated by HR. We had sessions on bloodborne pathogens, SDS, and harassment trainings, which are all required annually to provide to employees. We also have some additional trainings this Thursday for the highway and sheriff's department staff, and then virtual makeup staffs as well. In administration, we are working through a lot of year-end priorities right now, required IRS filings, WRS reconciliation, annual wage adjustments, and benefit changes with open enrollment. So very, very busy back there. If you recall, we did eliminate our HR specialist position with the 2026 budget. So we are absorbing additional duties and shifting some workload back there. So it's been very busy. I'm also currently working on annual department head one-on-ones to be able to share feedback, review 2025 accomplishments, and look ahead to 2026 goals. So meeting individually with departments as time allows there. I did receive today a letter of intent from our EMS union to open negotiations. Their current contract expires at the end of this year, so we will be in negotiations with our EMS union this year. Regarding the investigations that we've had in with the sheriff's department, later on the agenda today, we'll have a review of the investigation from Attorney Winstrom into the harassment and employment related issues. Regarding the investigation on some of the other discrimination and performance claims from the sheriff's department, I'm currently awaiting a response from our investigator on that.
For an update. So we'll provide that when we have that from them. The 911 board, just a brief update on that, since that is a new committee. We have had a couple of meetings now. We've had, I would say, some successful meetings and good conversations with all partners at the table to discuss some suggestions, concerns with 911 and how we can make some improvements there. Some changes have already been implemented, such as status checks, dispatching to fraud complaints, and also reviewing for efficiencies in technology access for dispatchers. And so just working with the various agencies, working together and interacting, working through some suggestions there. The board did agree with a recommendation on a reorganization of dispatch, which will go to the Public Safety Committee next month, and then will come to the full board for approval as well. The recommendation will be to move the 911 dispatch center, not physically move it, but move it reporting wise to be underneath emergency management, and that'll provide a more neutral structure, neutral structure that'll support all of the various agencies, strengthen the oversight and accountability, and also create some backup within the leadership between dispatch and emergency management that's currently lacking. So those recommendations will be coming next month. And then also at our department head meeting today, we did start discussions on planning for our annual county government days in April, where we host the high school students. So we're trying to get some dates on the calendar for that. No, that's all I have.
Very good. Does anybody have any questions for me? Very good. Thank you. All right, next we'll have our Clerk of Circuit Court's annual report with our Clerk of Circuit Court, Katrina Rasmussen.
Hello, everyone. My name is Rena Rasmussen. I'm a clerk of court here in Washington County. I'm just going to give you some updates from the courts from this past year. So our court is made up of 2 judges. We have 2 judicial assistants, and then we have a court reporter that's assigned to branch 1, and then a digital audio reporter that's assigned to branch 2. My office consists of myself, my chief deputy, and then we have 5 deputy clerks that handle the different cases. continued number of errors that we have with our scheduling in the courts. This could be attributed to the fact that we have a new judge that started in the recent past, and we did change up how we do our scheduling. So that's something that we're going to work on and continue to review. It was determined through positive feedback that we received that the clerk of court's office is known for providing a level of service that is knowledgeable, professional, and courteous. It was noted several times by various people that the department has great communication and works together as a team. So we want to make that a priority to continue that level of professionalism moving forward. And the last area that we determined that we need to focus on is staff retention. We have several people in our office that have been there for a long time. But we do have one position that we struggle to keep filled, and there's been a lot of turnover. So we're gonna work on that, do a couple of things. I'm very optimistic with this new person that we just hired. So overall, 2025 was a fairly positive year for us. CCAP, the program that we use to maintain our records, they continue to move forward to make our system as up to date and efficient as possible. So last year I mentioned that they started a 3-phase process of changing over our financial application. So this year phase 2 was rolled out, and we will likely complete the last phase this year. They've also made significant improvements that have helped us with our reporting requirements. So we report quarterly our interpreter expenses, and we also report our financial information annually. And the numbers that we submit for that determines what we receive from the courts for our state aid. So they created an interpreter payment request application, and they updated the application that we use to submit our annual report. So those have been pretty big changes that have helped a ton. So then the next thing that I want to highlight for 2025, which was the big one, is the Wisconsin Clerks Association joined together with the Wisconsin Counties Association to push for additional funding to be distributed to the courts. There was a legislative day that was held at the Capitol, and then where several clerks from across the state, they met with representatives to discuss the funding needs of the court. And also we invited representatives to our counties and then attended public meetings to push for this additional funding. So I personally was able to attend the legislative day and meet with several of the representatives. And then I also met with Senator Cabral Guevara when she came here to discuss that. So overall, it was a fairly successful venture. The state was not awarded, the courts were not awarded the full 70 million that we were asking for, but they did include a $10 million increase in the budget for the court system. And Washera County specifically saw approximately $63,000 in those additional funds. So that was the big part of the excess that we had in our revenue this year. So some of the challenges that I reported last year from 2024 also saw improvements in 2025. I reported last year that we had a significant increase in the number of appeals that were filed in our office. This year, last year I reported 19 from 2024. There was only 9 last year, so that's more typical number for our office, kind of back to normal levels. Our jury trials were also down slightly last year from 14 to 12. And also, if you recall from last year and the past couple of years, we've had discussions about the public defender issue and the fact that the counties were being responsible for appointing attorneys to represent individuals that were eligible for public defender. We are still experiencing delays in appointments, but we did not have to appoint any attorneys to be funded through the county this past year for public defender individuals. So that was very positive. So also this past year, I hired a new family clerk in February. Unfortunately, then we lost one of our criminal clerks in October. She resigned, but we did hire somebody else who started on Monday. So I'm very excited to be fully staffed again, and we are going to work on training and cross-training the deputies moving forward. So things are looking very positive. And that's all I have for you tonight. Does anyone have any questions?
Could I ask you, Rena, do you think, from this last legislation where they raised it by 10 million, do you think there's an appetite to keep raising it? Or do you think that was kind of?
I mean, I guess what I would say is, it was a big ask that we were not expecting.
The 70 million.
Yes,
Yeah.
we weren't expecting anything. I think, they paid attention, they listened. I don't know that it's going to continue to increase, but I also don't think that they're going to go back. So,
That's a step forward anyways.
yeah, I mean, I think we'll continue. The other thing that was good about that is there was discussion in other areas about how they can increase funding to the courts by changing certain laws and like costs for things. Yeah, so it definitely got the conversation started. It's been a very long time since they've actually reviewed the court funding, so.
Okay, good. Anybody else have any questions for Rena?
I've got one.
Okay,
Just curious, can you describe your interactions with judges, attorneys and other departments on a typical day?
So our office is actually like anyone's access to the courts. So we work with other departments daily. There's constant emailing, phone calls, and communications between us and the public defender's office. There's a morning email that goes with in custodies noted. We work with probation and parole, scheduling hearings and relaying information about restitution payments, things like that. The attorneys, any filings or anything that attorneys or pro se litigants are filing, they come through our office. And Sheriff's Department, we work very closely with them on everything. So our office is kind of the office that touches each one of these other agencies. So it's important for us to have a good working relationship with all of them. I think we do that well. We get lots of positive feedback from other agencies that we work with. And so I think we do a pretty good job with that, but we do work closely with several other departments.
All right, I got one other question. What advice would you give to county residents on navigating the court system more effectively?
I would say, don't be afraid to ask questions and read what you are receiving. Often people don't do their own research and their own legwork. And I think that the information is there, you just have to use it. And so we work very hard to make sure that when we're sending notices to people that we're putting very detailed instructions, phone numbers to call or Zoom instructions or things that they need to be filing or bringing or things like that. And we'll often get phone calls and people they are asking us questions that they already have the answers to. So I think it's just a matter of we're here to help. We can't provide legal advice. We can point you in the right direction, but they also have to do the work on their own too. So it's kind of a working together kind of thing. Take the guidance that we give and then do the work on your end of it too. So that's what I would say.
Okay. Any other questions? Yes.
The $63,000 that you received through the state, how does that get disseminated? Well, and who determines where that gets sent to?
So are you saying like from the state when they had the 10 million, how did they determine that Washera got 63,000?
That you actually received.
Yep.
How are you going to put it to use throughout the department?
Well, I mean, it just is going into operational expenses. I don't have anything specific that it's going toward. You know, in the past, I've reported, and I guess the one thing that people should know about our office is it's very tough to create a budget for the courts because we are at everyone else's mercy. So the number of individuals that need interpreters, we don't ever know what that's gonna be. So we can never really put an accurate number on that. It's kind of guessing. It's the same when we're appointing attorneys, guardian ad litems, or court appointed attorneys. We don't know how many people for the year are going to need that. Jury trials, we have no idea how many we're gonna have. So these expenses change so much. It's very, very hard for us to determine what it's going to be. So we didn't have anything specific to put that money toward, except for our, you know, our yearly and our budget.
Good. Any other questions?
So theoretically, you could be $63,000 over budget.
Correct. Yep. And so, I mean, another perfect example, so the other thing to consider with the court's budget is when we look at like attorney's fees that we're paying out, this year our guardian ad litem fees were very, very high. I have the number here, but they were way, way up as far as the amount of guardian ad litem fees that we paid out. But our guardian ad litem reimbursements were also up. So some of our attorney's fees, it's kind of a wash. The problem is we're never gonna get back everything that we pay out. We do our best to get as much back as we can, but we're never gonna get it all back. So some of those fees that are going out, we are gonna get something back on that.
Okay. Any other questions? Okay, very good. Thank you.
Thank you.
Appreciate it. Okay, next we'll have a presentation, Live Pay, Put It Away program presentation with the Waushara County Health Department, Jennifer Devitt, RN.
Hello. I'm going to talk about the suicide prevention project that is for Wisconsin. Again, I know you just introduced me, but I'm Jennifer. I'm a registered nurse with the Waushara County Health Department. One of my roles at the health department focuses on harm reduction and prevention. While I recognize that suicide prevention can be a challenging and emotional topic, that is precisely why respectful and open conversations like this are so important. These discussions help reduce stigma, address misconceptions, and remove barriers so individuals experience a crisis can access help safely and quickly. This program supports Wisconsin residents by providing temporary, voluntary, and safe firearm storage options during periods of elevated suicide risk. When I brought this program to local law enforcement and firearms retailers, Chief Mott of the Wautoma Police Department got it up and running rather quickly, which I think is a great example of community-led suicide prevention. However, after sharing the news of the program's start, there were some community conversations that have reinforced just how important clear and careful messaging is, especially when addressing sensitive topics like this. So that brings me why I'm here today. I just want to talk through some of the misconceptions and concerns that the public had about this program. I want to explain what the program actually is and is not, share why it matters from a public health and suicide prevention standpoint, and also make it clear that this program respects personal choice and individual rights. Little program overview. The program initially started to support veterans at risk. The program is now open to anybody seeking voluntary temporary firearm storage. This was developed in Wisconsin through the Governor's Challenge to End Veteran Suicides and the Southeastern Wisconsin Veteran Suicide Prevention Task Force. Sorry, I've got to skip my slide here. The program is supported by the Medical College of Wisconsin Psychiatry Department and the Captain John D. Mason Veteran Peer Outreach Program. This is built on the Gunshot Project, which trains firearm retailers to identify and respond to suicide risk. Recently, there was an expansion in April of 2024, where the program received a grant to support rural firearm retailers with secure storage. Currently, they're offering up to $1,500 for a safe, which would help remove the cost barriers and making participation easier.
The contract or?
I mean, or if you wanted to talk about
Yeah, I can do that. It's fine. So it did start with Captain John Mason, a Marine, who suffered from, PTSD, following his service in Vietnam. He was also a,
Excuse me, could you speak
Sorry.
into the mic there?
Yep, I absolutely can, sorry. Captain Mason was a Bronze Star Medal, Combat V, Medal of Valor holder. 70% of veteran suicides are with a firearm, which is kind of the reason they got this program started with the vets. 50% of those suicides are not related to a mental illness or a chronic mental illness. They are from a temporary crisis in a dire moment. So what this program does, the Live Today, Put It Away, it gives a voluntary place for people to bring their guns. We have a contract. It's pretty simple. It's 1 page and there's no tricks in it or anything. You fill out the contract, you bring your guns to us. When you're ready, you tell us when you want to get your guns back. I think some of the concerns that maybe came to Jennifer and myself were that law enforcement's going to infringe on Second Amendment rights and keep our guns. If for some reason there was a court case and the judge ordered you couldn't get your guns back for like you committed a felony or murdered someone while we had your guns, we're still not going to keep your guns. They might not be able to go back to you by the court, but we're going to return them to a family member that you designate. So your brother or your sister. Another rumor that was going around is that you have to go through a federal firearms background to get your guns back after you drop them off, and that's simply not true. Now we do, when we receive the guns, we run them through NCIC, which is just a way to make sure they're not stolen or used in a crime when they're turned in before we lock them up. And then when you come to get them, we run them again through NCIC to make sure that in that time we had them, it didn't pop that it was used in a crime, or the ATF ran ballistics on a gun and it came back to that it was involved in a shooting in Milwaukee. That's the only background stuff. You don't have to go through a full background. Some of it's personal to both of us. If you guys ever have a chance, Public Health and Human Services has a mental health guide. If we can save one person's life in doing this, it's well worth it. And again, I want to reiterate, we're not trying to keep anyone's guns. On the front page of this is my introduction to the mental health guidebook. There's a picture of my friend Tom. Tom was a Marine, correction, is a Marine because he is deceased. And if you know the Marines, he's guarding the gates of heaven right now. But I'll just read this little personal experience here and then I'll let you take back over. So last week I was at a high school football game. One of the players injured their arm and were carted off the field. We all know what happened next. The player's family probably took him to their family doctor, emergency room, or clinic. They all know what to do in those situations, but where do we go for mental health or substance abuse needs? I bet many cannot answer that question, but you or someone you know is facing these struggles. We all face struggles in life, and this guide will help you navigate you to the right location to say, I need help, which we need to add the Live Today, Put It Away to the guidebook. I write this in memory of my friend, Officer Tom Riley, dedicated public servant who tragically lost his life to suicide. Tom was not only a brave police officer, but a beloved father, friend, and colleague. Tom was a canine handler and narcotics officer. We spent many nights talking about the restoration of his 1967 Buick and my 1965 Chevrolet. I never saw the warning signs with Tom until the night I was kneeling alongside his 1967 Buick, placing him in a body bag. His passing serves as a stark reminder that mental health challenges can affect anyone, regardless of their strength, commitment, or position in life. Tom's story reflects a broader truth. Mental health struggles do not discriminate. Whether you're on the front lines of public service or working a desk job, or simply managing daily life,
Each of us faces moments of overwhelming stress, anxiety, or emotional pain. It is important to understand these struggles are not a sign of weakness, but a part of the human experience. The rest is just about the guidebook, but if Live Today, Put It Away can help save one life like Tom's, it's well worth it. And I appreciate the public health getting this program going here. And we now have a safe, or we're gonna have a safe. I didn't pick it up today because it was too cold. So, and my tailgate was frozen. But thank you.
Okay, I just wanted to talk a little bit more about the program and some of the suicide statistics. This is a program that is intended for somebody who's going through a difficult or overwhelming time. The key idea here is temporary increased risk. So when it's not safe to have a firearm in the home, the program is designed to be simple, voluntary, respectful of firearm owners' rights, and it's about safety during a moment, not judgment or punishment. Participation in this program is open to federal firearm licensees, law enforcement, and gun ranges who choose to sign up. These partners provide temporary firearm storage during a crisis, but not permanent surrender. The firearm owner decides whether or not they want to participate, how long the firearm is stored. Basically, the power stays with the gun owner throughout this process. As he had said, there is a contract, so that written agreement protects the firearm owner by clearly defining the storage timeline, so how long the gun will be away from the house, and guarantees return of the firearm as agreed upon. I just want to add to that, in order to get your firearm back, I think there were some questions on whether there was medical clearance needed. That's not the case. The court does not get involved with this. There's no court order. Or there's no evaluation needed to get your firearm back as well. So there's that. On this slide here, I just wanted to highlight how transparent the program is. So this is a screenshot from the actual program's website. It shows there are currently only 9 law enforcement agencies statewide participating. So the city of Wautoma is listed at number 9 there. And I circled the area where you can access that actual program contract. This is a website that's open to the public. That contract is available for anybody to review at any time. And while they're not yet listed on this website, I just do want to share too that our sheriff's department has also committed to participating in this program. Once those steps are finalized, they'll be listed on this website as well. So who participates? I just want to be very clear that it's not limited to law enforcement. In Wisconsin, actually 85% participating locations are firearm retailers and gun ranges, which I think clearly demonstrates that this program is largely supported within the firearms community itself. Law enforcement serves as one part of a broader community-based approach. Additionally, I'd like to add that I have reached out to firearms retailers here in Washington County. Currently, there aren't any licensed firearm dealers or gun ranges that are participating in this program. Of course, that doesn't mean that can't change, but it does often grow based on community interest. So if somebody would prefer to use a retailer for this program, I just really encourage them to go to their trusted retailer and share this program information with them if that's where they feel like they want to store their gun. So when law enforcement participates, the role is enforcement and support. It's about community safety, providing options and supporting individuals during a crisis. Again, this is about helping somebody through a difficult moment and not criminalizing them. And then having multiple types of locations involved helps ensure comfort, so people can choose what feels right for them. Choice. This is not a one-size-fits-all approach. And trust, which would increase the likelihood of somebody seeking help. So what this program is not. Let's see here. So this is not gun confiscation. It's not secret, it's not forced. Participation is always voluntary and initiated by the firearm owner. This is not a permanent surrender of a firearm. It's not a registry or tracking program, and it's not only about firearms, which I will get into shortly. So the focus is suicide prevention, not any Second Amendment rights. We know responsible firearm owners already take steps to protect the people they love. This program simply offers tools, storage options, and support to make that even easier. So why the program exists. So a little bit of suicide data here. This is the most recent data available from May of 2025. Suicide is currently the 8th leading cause of death in Wisconsin, and the 2nd leading cause of death of people ages between 15 and 34. This also states that in 2021, nearly 5 times as many people died by suicide than in alcohol-related motor vehicle crashes. This data comes from the Wisconsin Suicide Dashboard. That information comes from Wisconsin death records, so coroners, medical examiners, and law enforcement. The dashboard is publicly available, so anybody can access this at any time. I just wanted to point out that in 2023, over 50% of residents who died by suicide used a firearm as their method, and number 2 is suffocation. Additional data shows that over 30% of individuals who died by suicide had expressed suicidal thoughts or had disclosed their intent to another person within the month before their death, which I think underscores a critical opportunity for intervention during that time. This is a fact sheet that also comes from the suicide dashboard for Wisconsin. So this is identifying that rural Wisconsin men ages 25 and older as the population with the highest suicide rates. 2/3 of those used a firearm as their method. It's also identifying that secure firearm storage is a key prevention strategy. So that's something that this program directly addresses. This is the suicide prevention strategy outline. This is actually a 52-page report. And I just kind of put like a little clip in there that under page 27, there's a community-based prevention area. This specific program, Live Today, Put It Away, is listed as one of the evidence-informed resources. So this is actually where I first learned about this program. After researching it, I realized that Washington County, we didn't have any participants in it, law enforcement or otherwise. The closest option is Waupaca County. So that's really where it started, and I'm only really pointing this out because I just want to clarify that this isn't something that was created out of thin air. This is a program that's been around for a while. And we're building on work that's already successfully done elsewhere. So we're not reinventing any wheels or anything like that. A little closer to home for Washington County. This data comes from a time frame, let's see here, January 1st through 2023 through December 31st of 2025. These are from confirmed death records. The source would be the Wisconsin Department of Health Services, the Division of Public Health State Vital Records. Suicide by year, so in 2023, there were 5 deaths, 2024, 4 deaths, 2025, 7 deaths. The method, 11 deaths, so 69% of those people used a firearm, whereas 5 used a non-firearm. By sex, so male versus female, 81% were male, and 3 deaths were female, so 19%. So I think that reflects a consistent trend where men are dying by suicide at higher rates. From 2023 to 2025, Washington County experienced a 40% increase in suicide deaths. From 2024 to 2025, that increased to 75%. And if these numbers sound small or they look small to you, I just want to remind you that each number represents a life lost. Even small numbers matter. And these trends over time will help us understand where prevention efforts are needed. I just want to say too that we do have 988 in Wisconsin. This is a suicide and crisis lifeline. This is a free confidential service available 24/7 for anybody who's experienced emotional distress or a mental health crisis. The data on the right there is from July 2022 through November of 2025, so roughly over 3 years. Statewide, there were over 200,000 calls to 988. Washington County has received over 500 calls. And I'm just pointing this out to show that people are reaching out for help. And when they do, having programs and resources in place is critical. Lethal means safety, so that's kind of the heart of what the Live Today, Put It Away program is. It's a suicide prevention approach that focuses on reducing access to highly lethal methods during times of crisis. Because suicide thoughts are often short-term and impulsive, creating time and distance between a person and lethal means can save lives. This approach is temporary, voluntary, and respectful of individual rights, and helps people survive a crisis until it passes. So why does this approach work? Since suicidal thoughts are often short-term and impulsive, and many attempts happen with little or no planning, that period of highest risk is often minutes to hours versus days. So this research is from the Harvard School of Public Health, and it just shows how fast these crises can escalate. 71% of suicide attempts occur within 1 hour of the decision. 40 to 48% happen within 5 to 10 minutes, and between 1/3 and 4/5 of attempts are described as impulsive. So again, this is why time and distance matter. Time will allow the intensity of the crisis to pass, and then distance gives the brain a chance to slow down, create space for clearer thinking, emotional regulation, and that peak of impulsivity to decrease. And that pause can be the difference between life and death. And this program is just one way we can intentionally and respectfully create that time and distance. So what does this mean in the context of firearm suicides? When a firearm is readily accessible, a momentary impulse, that peak of emotional intensity can become fatal within minutes. Firearms are the most lethal methods used in suicide, and about 90% of suicide attempts involving a firearm do result in death. Whereas other methods often allow time to reconsider, time for someone to intervene, whereas firearms usually do provide that second chance. So removing lethal access to lethal means is one part of suicide prevention. On the screenshot there, where the big red circle is, that's from the website. So they do other parts of suicide prevention. So in addition to storage options, they support suicide prevention training for the general public and staff at firearm retail shops. They offer QPR training as well. So that's question, persuade, and refer. So that's an evidence-based prevention training that gives people practical skills and confidence to step in when it matters. On a side note, public health educator also offers this training, QPR training. So that training is available if you're interested. I'd be happy to connect you with her. The other thing it provides is printable resources on suicide risk factors, warning signs, veteran-specific suicide prevention trainings, and all these materials are public and available to anybody. That green box image also comes from the website, so that basically is just a simple tool that helps people decide whether their medications may be unsafe during a crisis and how to identify steps to reduce that risk. And then a side note on that, we do offer several options for safe medication disposal. So we do have the permanent drop boxes located at the Washington County Sheriff's Office, Watoma City Hall, Red Granite Village Hall, and Wild Rose Village Hall. And we also do the semi-annual drug take-back events. There's two options for firearm retailers that want to join the program. The first option is to receive suicide prevention materials to display in their shop. Those materials are developed by the National Shooting Sports Foundation, the American Foundation for Suicide Prevention, and Veterans Affairs. The second option, same as option number one, except you also provide temporary voluntary storage at their shop. So both of those options are easy to complete online. So some of the questions and concerns I just want to get through are, so if suicide crisis happens so fast, how is this supposed to work? So some crises can unfold in minutes, but stress and warning signs often appear beforehand. So if you remember from the suicide dashboard slide, over 30% of people did disclose their intent. And again, those disclosures are critical opportunities to talk about safe firearm storage and recognize that it may be a safe time, not be a safe time to have immediate access to guns. Isn't this just a way to take people's guns away? No, this program is completely voluntary. The firearm owner decides if they want to participate. as previously explained, there is a written contract, and firearms are returned according to that agreement. Ownership and rights are not taken away. What if somebody never gets their firearm back? Again, that goes back to the contract, which clearly outlines the return process and timeline, all of which the gun owner controls. Why focus on firearms when people can use other methods? So, suicide prevention isn't about just focusing on one method, but reducing access to the most lethal methods during short-term crises can save lives. As stated previously, over half of suicide deaths are far more lethal than other methods. Another question is, why is law enforcement involved at all? So law enforcement participation simply expands access. So we have more options as far as where to go with that. Another question that's not on the slide, but I thought I would add would be, what if somebody doesn't disclose intent or refuses to turn in a gun? So again, that's their right. The program is completely voluntary. I think it's important to be honest about the fact that we can't save everybody, but this program focuses on giving opportunities to increase safety whenever possible. So on the slide here, I just have some of the main points about the program, but I would also like to add that I understand that conversations like this can feel like an attack on firearms, but I want to be very clear that that's not what this is about. I'm a gun owner myself. I come from a family of hunters. My dad taught me to respect the power of firearms and the importance of safe, responsible use. I've also personally known people who have died by suicide, and I've seen the lasting impact it has on those that are left behind. And that kind of loss doesn't end there. In fact, it carries forward. There is research that shows that surviving members face a substantially higher risk of suicide. Some studies estimate that the risk can be up to 3 times higher. So this is why prevention matters, not just for individuals, but for entire families and communities. I also want to acknowledge that I know that not everybody is willing to remove firearms in the home, but that doesn't mean the conversation has to end there. There are alternative safety options. So asking a trusted friend or a family member to temporarily change a gun safe or a lock combination. You could have somebody hold on to a key during a high risk period. Any step that increases the time and distance during a crisis can make a difference. And we do have free gun locks at the public health department. That's just another tool and another option to support safety. Because at the end of the day, suicide prevention is about caring for one another, meeting people where they are, respecting their values, and keeping them alive during their most difficult moments. Questions?
Does anybody have any questions for Jennifer?
Okay, sorry if you don't have this data, but I was just curious, you had mentioned Wapaka County is the closest county that already has this in place.
That had it in place, yes.
Do you have any data from them of like the participation rate, or so like I would imagine it'd be hard to kind of quantify the impact of this program, but maybe like how many participants they've had?
So when you look into that kind of information about this, basically a lot of it is very confidential. So they don't outwardly share all the information. I do know that when I kind of looked some of that stuff up, that there was one participating agency that said that they had helped six families. I can't tell you where that agency was, but 6 different people. I think they say that like there's at least 12 people using the program at one time in Wisconsin. That was another thing that I had read, but you know, because it's confidential, they don't always like openly share this information.
Okay.
Yeah.
Any other questions? Okay, very good, very informative, thank you. Okay, next we'll move into appointments. The Board of Health, Patty Miller from Wautoma, her term will be January 1st of 2026 through December 31st of 2027. Is there a motion? Motion by Mr. King, second by Mr. Urban. Is there any discussion? Okay, you go ahead and vote on that. Okay, and her appointment is passed. Washara County Veteran Services Commission, Barbara Diedrich from Watoma, her term would be January 1st, 2026 through December 31st of 2029. Is there a motion for this? Motion by Mr. Wadle. Is there a second? Second by Mr. Peterson. Is there any discussion? Okay, go ahead and vote on that. All right, and that appointment also passes. All right, now bear with me. Next, we will, I'm gonna read a motion. I'm gonna read both motions and then we'll vote on both together to go into closed session. So a motion to convene in closed session pursuant to Wisconsin Stat Section 19.85 sub 1 sub G for the purpose of conferring with legal counsel for the governmental body who is rendering oral or written advice concerning strategy to be adopted by the body with respect to litigation in which it is or is likely to become involved. And this is review and discussion regarding correspondence received from attorney Retko on behalf of Sheriff Zilke. And number two, the motion to convene in closed session pursuant to Wisconsin Stat Section 19.85 sub 1 sub G for the purpose of conferring with legal counsel for the governmental body who is rendering oral or written advice concerning strategy to be adopted by the body with respect to litigation in which it is or is likely to become involved. This is a discussion with attorney Ovid Winstrom regarding findings of personnel investigation related to the harassment allegation. With that, is there a motion to go into closed session? Motion, motion by Tom, is there a second? Second by Pat, is there any discussion? Okay, and go ahead and vote on that then. Okay, we're in closed session then, and we will be